care in hand. We're here to help, we understand. From home to healing, near or far, you're in great hands with Concierge Star. Concierge Star nursing care that shines so bright. Professional, compassionate, day and through the night. Health, comfort, peace of mind, we're with you every day. Concierge Star nursing, your care, your way.
And welcome back to Concierge Star Conversations, where we have real nurses, real conversations, and real life experiences.
And today we are turning the tables.
Oh, yeah, because last episode we talked about the things patients do that nurses will never forget.
But today we're talking about the other side.
And that will be things nurses wish patients knew.
And before anybody gets offended,
Please listen first.
because this isn't about blaming any of the patients, this is strictly about helping patients understand what nurses actually deal with behind the scenes.
And trust me, some of these are going to make you say, wait, nurses really deal with that?
Yeah, let's get into it.
Let's get into it. So let's start with one that I think patients really need to understand. When you hit the call button, your nurse doesn't come running immediately, doesn't automatically mean that the nurse doesn't care, which I've experienced that myself.
Right. Exactly. So, because people don't always see what's happening on the other side of that door.
Right. So the nurse could be administering medication to another patient
Or she could simply be responding to an emergency,
or helping somebody who just fell
or talking to a physician.
or trying to get another patient stabilized.
And sometimes your nurse is literally just in the bathroom.
Right. And people forget that, we're human. The
We
nurses
are.
are human.
We are. We are very human.
And that's something people forget. Nurses can be responsible for multiple patients at one time. I mean, you yourself have talked about having to care for 20 people on one floor.
20 plus.
20 plus. Yeah.
Yeah. And every patient believes they're the only patient. Out of 20
Absolutely.
plus.
Absolutely.
Yeah.
And which nurses understand. When you're sick, all you're doing is thinking about yourself.
Right, and you should advocate for yourself. But there's a difference between advocating for yourself and assuming that nobody cares about you.
And that's a good distinction.
Right. So if you're having an emergency, then just say that. Don't just simply say, I need my nurse. Tell them what's happening, what's going on.
Yes, communication is number one.
Exactly, it matters. Let us know so we can attend to the problem.
Here's another one. Nurses wish patients would stop being embarrassed about telling the nurse what's really going on.
Yes.
Pain? Tell us.
Bowel problems? Tell us.
Medication you didn't take?
Tell us.
Something you did at home that you think we're going to judge you about?
Tell us anyway.
Excuse me.
Water break. We take those too.
Yes, stay hydrated, folks. And because your nurse can't make the best clinical decision if you don't give them accurate information.
And nurses have heard everything.
Everything?
You are
Everything.
not going to shock us, trust.
You might make them pause.
But you're probably not going to shock us.
Right.
Seriously, though, honesty can make a huge difference in your care.
So let's talk about patient advocacy.
This is one of my biggest ones.
Patients sometimes think they're being difficult when they ask questions.
They do, but the truth is, you are not being difficult for wanting to understand your own care.
Ask what medications you're receiving.
Ask why you're receiving the medication.
Ask what the procedure is.
Ask what happens next.
And if something doesn't feel right,
Please speak up about it.
please don't sit there thinking, I don't want to bother anyone.
Your health is definitely not a bother.
Absolutely. Okay, now let's talk about this one.
Oh boy.
Patients will Google one symptom.
Oh, we talked about this in our last episode.
Yes, we
And
did.
suddenly they are dying.
Got one diagnosis and 72
Oh
issues.
my goodness.
You go to Google and type in you have a headache. Next thing you know, Google says you have 17 different diseases.
Exactly. Then you walk into the hospital, convinced you already diagnosed yourself with all these diagnoses.
Right. Now, now we're not saying not to educate yourself.
Exactly. Education is good.
Right. But internet information doesn't replace an individualized assessment by your nurse.
Exactly. And also, don't compare your situation to others, like your cousins, your friends, or somebody you saw on TikTok or Facebook.
Right. Because two people can have the same symptom for completely different reasons.
Totally different reasons.
Right.
This is something people don't realize.
And what's that?
Nurses are constantly observing you.
Absolutely.
You may think we're just checking your blood pressure, but we're looking at how you're breathing, your color,
The mental status,
even how you're moving,
how you're speaking.
whether something has changed from earlier. Sometimes the little things are what make us say something isn't right.
And that's why nursing is more than checking boxes.
Exactly. Don't just check a box. We don't even look at the machines are not the determining factor. The patient is always the determining factor. The machines help you along the way, but we're always observing the patient.
Absolutely. So let's talk about medication.
Okay, now this is definitely huge.
Now, patients sometimes don't realize how important it is to tell their nurse about all the medications they are taking,
Like prescription medications.
or over the counter medication.
The one everybody forgets. Vitamins. Vitamins are medication.
Right. And herbal products and supplements are as well.
Exactly.
And they can cause a counter reaction.
They can.
I've
They can.
experienced that too.
Yep. And it can alter your labs. If you're getting too much of something, you may be getting too much magnesium, too much vitamin C. They can alter your labs.
So I guess it's basically safe to say anything that you take regularly, you should let your nurse know.
Anything you're taking regularly, yes.
And please don't assume that because something is natural, it won't interact with the medication.
Exactly.
Again, falling back on that statement I made I
Earlier.
experienced that.
Yeah, exactly.
So your healthcare team needs to know the full picture.
The full picture. The full rollout. We need to know everything. Vitamins, supplements, drinks, herbal, whatever it is, we need to know it. Prescription, something you just gave yourself, whatever it is, let us know.
Right.
Okay, so this one might be a little uncomfortable for some people.
Well, let's hear it.
Nurses can tell when somebody is exhausted.
That they can.
When you're not eating, when you're not drinking enough,
When you're overwhelmed.
when you're scared.
When you're pretending everything is okay.
And sometimes patients need somebody to say, hey, how are you doing?
And that can mean a lot to that person.
Yes.
And that's where nursing becomes
very human. Yes, ma'am.
Very human.
Yes, ma'am.
So let's bring the families into this conversation.
Okay, sure.
Now, families can be scared, frustrated, exhausted, and overwhelmed.
Yep. Because sometimes that frustration comes out towards the nurse.
But the nurse also understands that family members may be experiencing one of the scariest moments in their life.
Yeah, so that means communication needs to go both ways.
So again, communication matters.
Yes, ma'am.
They can't hear your brain, Gotta speak up.
Speak up.
Families should ask questions.
All the time. And nurses should explain when and what they can.
And everybody should remember that everyone's on the same team.
We're all on the same team, no matter how you look at it. We're trying to get you better and get you back home.
So now let's have a little fun, Tamika.
Okay. So I have some stories.
I'm sure you do.
Patients will tell you they're perfectly fine,
While looking absolutely miserable.
or they'll say, I don't need any help walking.
And 5 seconds later,
Nurse!
took a bite out of crime. These moments can actually become one of the most memorable moments of nursing.
Oh, definitely. That's those moments you'll never forget. Trying to help your patient, giving them the right things to do, and then they turn around and do something like that. You're always, when you walk back in that room, you're just shaking your head like,
I told
you want to say I told you so,
right?
But, you try not to take it there.
right. But there's another side to this.
Absolutely.
Sometimes patients become unforgettable for reasons that aren't funny.
So you remember the patient who changes your perspective,
The patient who taught the nurse something,
the patient who reminded you why you became a nurse,
the family who came back months later just to say thank you.
Oh, I've had those moments. Those moments stay with you, actually.
Absolutely. That's something the public will never understand about nursing.
We don't always leave work, and we don't always leave everything behind, as they say.
Some patients just become part of your story.
And that's just the bottom line.
Mm-hmm.
So, I'm going to do a little segment on here called What Nurses Really Want from Patients. I'm going to give a list of my top 10 that I think nurses really want from patients. And this just from me being a nurse, right?
Mm-hmm.
So, my number one would be tell us the truth. Ask questions. Speak up when something changes. Tell us what medications you're actually taking. We just talked about this. Remember, we're human too. We're not robots. And we're not mind readers. We're not in the matrix.
Right.
Don't be afraid to advocate for yourself. It's your health at the end of the day. Don't assume we're ignoring you. Again, 20 plus patients in some of these places, even in the hospitals, 5 plus patients, and there's even more going on there. Give us accurate information. Let us know when you don't understand something so we can break it down even further or get someone to help you understand what you need to take away from the process. Treat healthcare workers with respect. My final thought on that. Definitely, that is one of my top. I should have said that for number one. Treat healthcare workers with respect because you want healthcare workers to treat you with respect. How the old saying goes, treat others as you want to be treated.
Exactly.
Apply all those things.
Right. Okay, we're turning the conversation over to you, Tamika.
Okay, so if you've ever been a patient, we want to know.
What is one thing you wish your nurse knew?
And nurses,
what is one thing you wish patients understood about your job?
drop it in the comments.
And don't just say something negative.
Tell us something that would actually help nurses and patients understand each other better.
So now that brings us to my favorite section, the rapid fire round.
Okay.
So a patient who Googles symptoms.
Educate yourself, but don't diagnose yourself. That sounded good, right?
It does. It does.
Yep.
Patients who don't tell you their medication list.
Please tell us everything that's on that medication list.
And patients who don't ask questions.
Please ask the question.
What about this one? Family members who have 47 questions.
Oh, baby, bring the questions. Bring the questions on. We never scared. Bring those questions. We want to answer all those questions to get you in the right head space.
Patients who say they're fine when they're not.
Tell.us.the.truth, please.
Absolutely. Absolutely. Patients who remember their nurses years later.
Those are the moments that make nursing worth it all.
Absolutely. So I think the biggest takeaway from today's episode is that healthcare is a relationship.
It's definitely a relationship. It's not just a nurse taking care of a patient.
Right. It's about communication,
It's definitely about trust.
advocacy,
Most definitely about respect
and compassion.
and sometimes humor.
Yes, definitely.
Gotta laugh a little bit. Gotta
Right.
laugh.
Right. And because, let's be honest, nurses need humor to survive through these shifts that they work.
Absolutely.
So, audience, you've been listening to Concierge Star Conversations.
Real nurses,
Real talk.
real impact. If today's conversation made you laugh, think, or see nursing a little bit differently, share this episode with somebody, subscribe to the channel, and follow Concierge Star Nursing.
And tell us what you want us to talk about next.
Because this conversation is always bigger than nursing.
It's about people.
See you next episode.